friends, welcome back to my channel Agape Vlogs. You might be surprised why I am back so fast. It's only because I respect the wishes of my subscribers, Julie from Zambia and Lavina from India. They have requested me to post as soon as possible because they are taking their exams in the nearby days. That's why I am back very soon with this post. Hope it will be helpful for many others too. Well, this is test 2 of part 1, and if you haven't viewed any of my previous videos, you please refer to those videos. In that you can find test 1 from questions 1 to 25 in one video. The next video has questions 26 to 35, and the third video has questions and answers from 36 to 50. So also refer to those videos so that you can prepare very well for your exams. Best of luck in advance. Friends, before starting with, as usual, let me remind you of one more thing. While answering the questions, take a paper and note down your scores so that towards the end of the session you can find how well you scored. Well, let's begin with the first question. What position should you prepare the patient in pre-op for abdominal paracentesis? Option A, supine. Option B, supine with head of bed elevated to 40 to 50 centimeters. Option C, prone. And option D, side lying. So what will be the answer? Option B is the right answer. The position is supine with head of bed elevated to 40 to 50 centimeters. So, for those who want to know what is abdominal paracentesis, let me give a short note. It is a simple bedside or clinic procedure in which a needle is inserted into the peritoneal cavity and ascitic fluid is removed. And diagnostic paracentesis refers to the removal of a small quantity of fluid for testing purpose. And paracentesis, it's the perforation of a cavity of the body or of a cyst or a similar overgrowth, especially with a hollow needle to remove fluid or gas. So that is paracentesis, and I have already told what is abdominal paracentesis, and I have given you the explanation for diagnostic paracentesis. So let's move on to the question number 2. Lumbar post-op patient moving and handling. Option A, move patient as a unit. Option B, move patient close to side rails so he or she could assist herself. And option C, move with leg raised or flexed position. So lumbar post-op patient moving and handling is going to be move patient as a unit. Got it? You should always move patient as a unit. And coming to the third question, what is not a sign of meconium aspiration? Option A, floppy in appearance. Option B, apnea. Option C, crying. So, what is the answer? You have guessed. I guess you have got it right. The answer is option C, that is crying. The question is, what is not a sign? You should always read the question correctly, because sometimes it can be a positive or a negative. So you should always look for if there is a not, or if they are asking for a sign of meconium or not a sign. So you shouldn't be very fast in reading the question. Read it very carefully. So what is meconium? I'll give you a note on it. Meconium is the first feces or stool of the newborn. So let me brief on what is meconium aspiration syndrome. It occurs when a newborn breathes a mixture of meconium and amniotic fluid. So most newborn infants start to breathe well without assistance and often cry. Infants should cry or breathe well after delivery in a normal case, and if after the baby is born he is active and crying, no treatment is required. So here the answer is crying. So I think you have got the explanation registered. The answer is crying. Again, you won't forget, I guess. Okay, let's move on to the next question. Question number 4 is: a suicidal patient is admitted to psychiatric facility for 3 days when suddenly he is showing signs of cheerfulness and motivation. The nurse should see this as option A, that treatment and medication is working, option B, she has made new friends, and option C, that she has finalized suicide plan. So, what is the answer? I'll read the question once more. A suicidal patient is admitted to psychiatric facility for 3 days when suddenly he is showing signs of cheerfulness and motivation. The nurse should see this as the answer will be that she has finalized suicide plan. Okay, that's the answer. So that's a very sad answer in fact. Let's come to the 5th question. Patient has next dose of digoxin but has a CR that is equal to 58. Option A, omit dose, record Y and inform the doctor. Option B, give dose and tell the doctor. Option C, give dose as prescribed. Option A, omit dose, record Y and inform the doctor is the right answer. Moving on to the 6th question. Patient is in for oxygen therapy. Option A, a prescription is required including route, method and how long. Option B, no prescription is required unless he will use it at home. Option C, prescription not required for oxygen therapy. Option A is the right answer. Patient is in for oxygen therapy. Option A, a prescription is required including route, method and how long. So that's going to be the answer. And let's move on to the 7th question. Adequate record keeping for a medical device should provide evidence of. Listen to the options correctly because you have quite a number of options and you will have to choose the right one. So the options are: option A, a unique identifier for the device where appropriate. And option B, a full history including date of purchase and where appropriate when it was put into use, deployed or installed. Option C, any specific legal requirements and whether these have been met. Option D, proper installation and where it was deployed. Option E, schedule and details of maintenance and repairs. Option F, the end of life date if specified. Option G, all of the above. Definitely the answer is all of the above. Adequate record keeping for a medical device should provide evidence of all of the above. So let's move on to the 8th question. The doctor prescribes a dose of 9 milligrams of an anticoagulant for a patient being treated for thrombosis. The drug is being supplied in 3 milligram tablets. How many tablets should you administer? So listen to the question. It's a little bit of math. The doctor prescribes a dose of 9 milligrams of an anticoagulant. Okay, and the options are 3 tablets because the drug is being supplied in 3 milligram tablets. So the question is, how many tablets should you administer? The options are 3 tablets. Option B, 1.5 tablets, that is 1.5 tablets. And option C, 6 tablets. So what is the right answer? It's quite easy. Option A, 3 tablets is the right answer. So let's move on to the 9th question. The doctor prescribes 25 milligram of a drug to be given by injection. It is a drug dispensed in a solution of strength 50 milligram per milliliter. How many milliliters should you administer? So the question once again, the doctor prescribes 25 milligrams of a drug to be taken by injection. It is a drug dispensed in a solution of strength 50 milligram per milliliter. How many milliliters should you administer? So first option is 2 milliliter, second one is 1.5 milliliter and third option is 0.5 milliliter. Dose prescribed, dose per milliliter is 25. Dose per milliliter minus 25.50 is equal to 0.5. So you'll get the answer 0.5. That's option C is the right answer. Got it. So moving on to the 10th question. A doctor prescribes an injection of 200 micrograms of drug. Listen to the units of drug. It is not milligram, it is micrograms. So be very careful when you are administering drugs. The units are very crucial. They play a very crucial role. So be very, very careful in this area. The stock bottle contains 1 milligram per milliliter. How many milliliters will you administer? Options are: option A is 20 milliliter, option B is 2 milliliter, and option C is 0.2 milliliters. So remember, the stock bottle contains 1 milligram per milliliter, and the doctor prescribes the injection of 200 micrograms of drug. So you have to bear in mind the two dose values must be in the same units. First of all, you have to check the units. So you will have to convert the units because it is given in micrograms, and the stock bottle contains 1 milligram per milliliter. So 1 milligram is equal to 1000 micrograms. Here you are given 200 micrograms. So 200 micrograms will be 200 divided by 1 milligram is equal to 1000. 200 divided by 1000, and you will get 0.2 milligrams. So the option is going to be right option is going to be 0.2 milliliters. That is option number 3 or option C. Got it? So let's move on to the 11th question. If you witness or suspect that there is a risk to the safety of people in your care and you consider that there is an immediate risk of harm, you should: option A, listen to the options carefully, we have quite a number of them. Option A is report your concerns immediately in writing to the appropriate person, escalating concerns, NMC. Option B is ask for advice from your professional body if unsure on what actions to take. Option C is protect client confidentiality. Option D is refer to your employer's whistleblowing policy, and option E is keep on accurate record of your concerns and action taken. Option F is all of the above. Definitely the answer is all of the above. To the next question. In interpreting ECG results, if there is clear evidence of atrial disruption, this is interpreted as: option A, cardiac arrest; option B, ventricular tachycardia; option C, atrial fibrillation; option D, complete blockage of the heart. I'll repeat the question. In interpreting ECG results, if there is a clear evidence of atrial disruption, this is interpreted as AFib. So option C, atrial fibrillation, is the right answer. Hope you got it right. So let's go on to the 13th question. Common signs and symptoms of a hypoglycemia. Exclude, not include, exclude. Options are: option A, feeling hungry; option B, sweating; option C, anxiety or irritability; and option D, blurred vision; and option E is ketoacidosis. What's the right answer? Come on. The right answer is ketoacidosis. That is the last option is the right answer. How many of you have got it right? Okay. Well, so it was the common signs and symptoms of hypoglycemia, excluded ketoacidosis. So that is the right answer. Hope you know what is ketoacidosis. Should I give you a note on that? Should I? A diabetic ketoacidosis is a buildup of acids in your blood. It can happen when your blood sugar is too high for too long. So it is a serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones. That is ketoacidosis. Give a short note on the early signs and symptoms of hypoglycemia. It includes shakiness, dizziness, sweating, hunger, irritability or moodiness, anxiety or nervousness, headache, etc. So I think you got it right. Let's be moving on to the 14th question. Select 4 common causes of hyperglycemia. Option A, not eating enough protein. Option B, eating too much carbohydrate. Option C, over treating hypoglycemia. And option D, stress. And option E is infection, for example, cold, bronchitis, flu, vomiting, diarrhea, urinary infections, and skin infections. So quite a few options are there. First option is not eating enough protein. That is the only wrong option. All the rest are the right options. So all the rest of the options are 4 common causes for hyperglycemia. And the last question, that is question number 15. Safeguarding is the responsibility of option A, healthcare assistants, option B, registered nurses, option C, doctors, and option D, all of the above. I know all of you have got it right. The answer is option D, all of the above. Well, thanks a lot, friends, for subscribing my channel Agape Vlogs, and few of you have given likes, comments, etc. I thank you all from the bottom of my heart. Do continue to listen to my post and try to learn from it and give your valuable feedbacks. If you haven't subscribed, if you find this useful, do subscribe and share it with your friends. Wishing everyone a very successful career in the future.